repositioning maneuver. The Gans repositioning and Savant liberatory maneuvers were designed for people who either couldn't bend at the waist, shouldn't bend at the waist, had mobility issues. Those mobility issues could be because of weight or just mechanical issues. So these two treatments are sidelined, really quite easy. But what we have to do is we have to recognize there's two ways to get people laying down on their side. The other reason that side lying is such a nice technique is because it's what people do. They lay down in bed on their side. They get into bed and they go, night-night. Okay? So I basically tell the patient, I'm going to put you to bed. Okay? There's two ways to do this. If this is a young, healthy person, turn your head. So this is the right ear. In order to get the right ear down, they actually have to turn their head to the left. Okay? There's two ways to lay the patient down. One is to simply let the patient lay down on their own, but I don't want them using their hands. I want them tied up here. Because if I've got them laying themselves down, it won't work. I need this to be suave. I need this to be smooth. So the person can bring their legs up themselves, or I can use my leg and kind of guide them. So come on, lay down. See what I did? Okay. Look at her ear. Would they drop? Absolutely. Just come on up yourself. If you have an older patient, the best way to do this is a bed transfer. It takes no strength. It's all mechanics. I'm going to put my arm right here so the patient's head is completely supported. This is how I treat patients in hospital. Okay? It doesn't matter how big the person is. There's no strength. I'm going to reach underneath their legs, and I'm going to go to my left as I move them to the left. Ready? Come and lay down. See that? Okay. Position 1 of the Gans and the Savant maneuver are identical. You also could use this as a modified hall pike, side-lying hall pike. Okay? Gans repositioning. Ready? Come to the other side of the table. Well, no, I'm going to the other side. You can stay there. It's not that exciting. She can push off if she wants. Sometimes you can get people to use their legs, but a lot of times they don't have enough flexibility, so it's easier just to roll them. Okay? So I want you to roll towards me. Are you ready? Mm-hmm. Now we're going to do this a little. They're going to be like a hot dog in a bun. Okay? Roll towards me. Okay? We wait a second or two. Remember the nystagmus or vertigo? Shake your head no. We wait a minute after we stop. It's only two positions. Position 1, position 2. Unwrap. Shift. Don't lift. I want a tip. Yeah. I believe. Okay? How simple is that? Okay, start your engine.